It's 2021. The world is facing the worst pandemic in over 100 years. About 142 million people were affected, and over 75% of people have been isolated. More than 1 billion people are elderly and in need of tactical help with basic services. Mental disorders such as anxiety and depression have grown. In 2012, there were over 800,000 estimated suicide deaths worldwide. By 2020, this increased to about 1.5 million. To fulfill the UN goal for ensuring healthy lives and promoting well-being within the constraints of a global pandemic requires innovative and practical solutions. While technology can track and trace, connect, and push targeted content to those in need, this will not be enough to meet SDG goals 3.3 and 3.4. So what to do? Of all that's happened this past year, we've learned that the one thing that people need above all else is other people. Never before have people been so isolated and alone. Zoom daily meeting participants increased from 10 million in December 2019 to 300 million by April 2020, reflecting the need for contact. The Local Angel application will provide people with the first ever global volunteer-based human-to-human community building application. The application will connect locally based, registered, and officially vetted professional and lay community members with people in need of help. It will achieve this through the use of mobile-based Apex applications that link up with an Oracle database. Data will be captured for application and service improvements. Volunteers will be notified of new requests for help based on the confirmed skill sets registered, and service calls will be authorized and GPS tracked. To see how it works, let's walk through a case. The Mungikars, age 57 years, live alone in India. Their only son is in the US. Mrs. Mungikar suffers from COVID and has to self-isolate for 2 weeks. Her husband is a diabetic. They wonder how to get his insulin injections while his wife recovers. They are anxious due to the need to get to the banks, get utilities, get groceries, and medicine. Through Local Angels, they are able to get connected with 3 volunteers, one to get the groceries and pick up their medicine, one to calm their anxieties, and another to administer the insulin. Local Angels is a unique cloud-based scalable mobile application that both empowers volunteers with target resource content and connects volunteers with people in need through a social media type platform in which people gain incentives through discounts and deal based on co-marketing agreements with support partners. There is significant demand-supply gap plaguing the Indian healthcare system. While India accounts for 20% of the global disease burden, it accounts for only 6% of global hospital beds and 8% share of the doctor and nursing staff. Local Angels' business model is poised for success because it seeks to coexist and assist the current healthcare system and networks in India. Few other applications are available that provide similar services. Those that do are either not available in India or are not successful due to their dependencies upon NGOs and organizations. Local Angels is based on people helping people through volunteering, and so has the potential to compete in the market. To achieve funding and support, Local Angels, as an NFP, will seek funding through a combination of venture capital, government contracts, grants, and co-service partnerships with local government, hospitals, and community centers to facilitate delivery of the relevant services, ensuring that learnings can be captured before rolling out the product. In India, this includes Avishkar, Startup India, Smile Foundation, and others. Our team members work together from all over the world. We're from the US, India, Pakistan, and Australia. Thank you so much for this opportunity.